Dear friends, let's continue our tutorial. We are still in the indications. We've spoke already about the indications in rehabilitation in the field of vascular disorders, and there especially about the peripheral arterial occlusive disease, also about the venous congestions, primary venous congestions, and chronic venous insufficiency. We spoke about the lymphatic congestions and the lymphedema, and today we are going to talk about the lipedema and others combined edemas or elephantiasis. The lipedema is quite a common disease. That's how it looks like, and it occurs almost only in women. Only in women. Around 10% of all women are affected. Imagine that's a lot. It's an unbelievable, huge, big potential. The disease is progressive. It starts and continues, becomes worse and worse, and it causes extreme psychological pressure for those who are affected. Psychologically, the lipedema is an accumulation of fat, of lipids, triglycerides in the fat cells. There is the skin, epidermis, the cutis, and subcutaneous fatty tissue. There are the fat cells, and there are more lipids in the fat cells. We see it here again, subcutaneous fatty tissue, and there are much more bigger fat cells, filled fat cells. The cause of the lipedema is still unclear until today. Some say it's more genetical influenced. Typical, the daughter looks the same way like the mother looks. It's one aspect. But others say no, it's a vascular disease. It's a kind of vascular weakness, a primary microangiopathy of small blood and lymphatic vessels. And this is indicated because the lipedema very often shows hematomes. Those hematomas, they occur frequently. Diet or eating habits, by the way, do not have any influence. If they suffer from lipedema, you can get not rid of it or even reduce it by a diet. In contrast to lymphedema, the lipedema occurs always on both extremities uniformly. This is the lymphedema, one leg only. This is the lipedema, two legs. The lipedema passes three stages, that should we know as well. The stage number one is like this. Smooth skin surface, a light cellulite is possible. Cellulite, you remember last lesson, it has a certain tendency to riding bands. Those saddlebags, they are here on the outside of the thighs. It's a pulpal adipose tissue thickenings that appear symmetrically on both sides the same, also important, typical for the lymphedema. And they all feel like small styrofoam balls and they're pretty painful. That's stage one. No swelling or only little swelling. Stage two, the skin is becoming uneven, wave-like skin surface with larger dents. Some call it the mattress phenomenon, sleeping mattress phenomenon. The nodules in thickened areas of skin that can be as large as walnuts, increasing disproportion between torso and legs of arm due to fat distribution on the lower extremity. It looks not very typical human-like, so to say. And as stage three, strong increase in volume of the legs with pronounced increase in circumference. Hardened tissue cause fat flaps with overhanging tissue. Disturbance of gait pattern, those knock knees, X-legs, some people say. In total, there are 5 types. The ones affected can suffer from the fat accumulation on the hips only, or on the hips and on the thighs, or on the hips, the upper thighs and the lower thighs, on the arms, by the way, about 30% of the lipedema on the arm, and on the lower thighs, more or less only. These are the 5 types. The overall symptoms are the patients feel heavy leg and they feel the tension 24 hours a day. They are pressure sensitive. They feel pain. There are the bruises and the hematomes. There are knots in the tissue. There are dents in the tissue. It looks like the orange peel skin. And the strong psychological stress. These are the overall symptoms. And the therapy guidelines, you can imagine what it is. Intensive manual lymphatic drainage, the MLD. There are cures offered, and those cures, they last several weeks, and they prescribe daily MLD and daily for more than 1 hour. Compression bandaging after each MLD, so it's written in the guideline. Permanent compression stockings, lifelong. Cosmetic care to avoid inflammation and wounds from shaving, that's sure it's very important. And depending on the characteristics of the lipos, of the lipedema, liposuction. Liposuction means you bring in your curette and you suck it off. So it looks like after with all the problems that it has. We'll talk about it. So we come to the bottlenecks. The MLD, the manual lymphatic drainage, is very time consuming and labor intensive. The compression bandaging can only be applied by specialists. The permanent compression stocking leads to a dysfunction of the physiological muscle pump because it inhibits the collagen synthesis. So the connective tissue is becoming even weaker. And after the liposuction, the recovery periods are quite long. It established additionally that liposuction established additionally a vascular and tissue weakness. Some women made the experience once liposuction, always liposuction. Okay, let's talk about the advantages of IVD or Vacuumed therapy of lipedema, of that widespread serious disease. Number 1, the results in reducing the edema are significantly faster with the IVD than compared to the MLD. With the IVD, you have simultaneously a vascular training, and that vascular training even strengthens the arteries and the veins. As a result of IVD, the patients have immediately less bruises and hematomas. The skin appearance becomes significantly smoother, and that very, very quickly. And the fast recovery after liposuction is proven in studies. You will get from Professor Campisi, the chairman of the International Society of Lymphologists. You will get a study on that as an enclosure. Other advantages of IVD in the therapy of lipedema, there are automatic preset treatment programs, and they make the treatment very, very, very easy. So more patients can finally be treated, and that treatment meanwhile becomes very contemporary, and it is inexpensive. Once there is the device can work 24/7. It's profitable for the clinics for sure and for the hospitals. Your target group, who is involved in the therapy of the lipedema. There are the specialists in vascular diseases, phlebologists for the veins, lymphologists, also angiologists. There are the dermatologists, the cosmetic surgeons, plastic surgeons. They are involved. They all need to have the vacuumet, the IVD, and the vascular surgeons. Well, also the hospitals, they want to make money with the therapy, and here they can. Also, those medicals are facilities. It does not require the experts for these treatments. So, IVD offers new perspectives in the therapy of lipedema. Lipedema, once again, the widespread disease so many women seriously are suffering from. IVD is the solution, is the answer, a new answer, which was not known yet so far. Let's have a look to the combined lymphedema and the elephantiasis as well in this chapter. This is the lipedema. Both legs are affected, and here we do have a combined lymphedema. It's not only the fat accumulation, but also accumulation, huge accumulation of lymphatic fluid. That is what you also can have. The therapy requirements are the same: lymphatic drainage and the guidelines, the compressions and liposuction. This is an elephantiasis. Elephantiasis is something special. It can be innate, so you are born with. The lymph vessels are not pronounced, or the valves in the lymph vessels are defects, so you cannot have a pressure in the lymphatic system again. But more often, it's acquired as a result of an infection. For example, roundworms, mosquitoes, or the result of leprosy. The worms, the mosquito, the leprosy. Okay. The standard therapy here as well: manual lymphatic drainage, lifelong, and compression. What else you want to do? What else for sure? Give the IVD. If the people fit in, let them have the vacuum med treatment, because they have an immediate relief. Immediately. It's inexpensive and super effective. It can help even larger groups of people, even without specialists. Once again, flow is the name of the game in all kinds of edema, and especially also in elephantiasis. And flow is what the IVD is providing. We're coming to the end of this chapter, chapter 3 to 4, the lipedema and elephantiasis. You should now be able to explain what is the difference between lymphedema and lipedema. You will see it immediately. Remember, both legs the same, lymphedema. Only one leg, sorry, both legs the same, lipedema. Only one leg, lymphedema. For which people are lipedema typical? How many percent of them are affected? What's the standard therapy of lipedema? What are the advantages of IVD in the treatment of lipedema compared to standard therapy? What are combined edema? What is the cause of elephantiasis? What are the benefits of IVD in the treatment of elephantiasis? And who are the target groups? So this was the today's chapter. I say thank you very much, and give also a look to the attached study of Campisi as well. Thank you very much.